Hello and welcome to yet another episode of the Indulge Podcast. Today we have a very special guest, especially for animal lovers. We have with us today Dr. Charlotte Gray, a veterinary nutritionist, and she has her veterinary degree from the Cambridge University. She has worked in clinical practice for over 13 years, spending the last 5 years working primarily in the field of clinical veterinary nutrition. She is the owner of Companion Nutrition, founder of the Raw Vet Company, and Chief Knowledge Officer of Pet Prakalp India Private Limited. Dr. Gray has an extensive practice in the field of canine nutrition, and her consulting work includes accepting clinical nutrition referrals from veterinarians, providing home-prepared recipes for individual pets with the nutritionally responsive disease, primarily audit and formulation of balanced, raw or home-cooked, minimally processed diets for dogs, formulating for pet food companies across the world, including UK, USA, Spain, Canada, Dubai, and India. She also teaches courses in canine and feline nutrition for owners and paraprofessionals. Dr. Gray has been part of the Technical and Veterinary Nutrition Advisory Committee of Pet Food Manufacturing Association of the UK. And she is also the founder and lecturer of the first UK accredited veterinary nutrition certificate program for general practitioners. Hello, Dr. Gray, and welcome to the Indulge Podcast.
Hi.
Hi.
Yeah, it's great to be here. I'm quite excited.
Yeah, thank you so much for making the time. And it's great to have you in Chennai. It's great to have you in India. What brought you here?
It's a long story. So I formulate pet foods for companies all over the world.
Yes.
So I've done UK, USA, Spain, Canada. And Danu contacted me for some formulations for his new pet food. And this was maybe 2019, so a long time ago. And he said, can I create these pet foods because they have an idea and they'd like to try something out. So I did my job like I usually do. I created the formulations, we sent them over. And usually that's where I would break ties and say, thank you very much. I'll move on to my next job. This time around, Danu sent me the analysis. So he said, okay, I've done the food. I've run the analysis, and would you like to have a look? I said, oh, yes, please. Great. So, and I tell this story a lot because it was quite fun. I sat in my office at the Raw Vet with my nurse sitting next to me, my vet nurse, and I was ticking these values, and we were just seeing that when we formulate a food, we predict the nutrition level, and the losses in processing are something you don't know until you process. And actually, as I went through these values, you can see these values are almost no loss. So they found a way to produce a food where the losses were, sometimes 50%, 80% less than you would lose if you were having things like kibble processing or tins. And because I work in this sort of area where we use very much less processed foods, so raw foods, fresh foods, I said, actually, given the way that this industry has moved in the UK and the USA, I think you have a product that will be spectacular. I think this will be huge, and I think this will be life-changing. Can I stay? Okay. So I asked to stay, and that's what happened. And from then, they've done their launch, and now, a few years later, I've come to India to speak to the vets primarily and speak to everybody else about what it was we've been doing for 2 years at Right for Paws.
That's amazing. So, Right for Paws is this organization that's brought you here,
yes.
And you're going to be conducting some workshops.
Yes.
And you're going to be, all right.
Yes.
Okay.
So, Right for Paws had me mostly booked to do veterinary seminars. So we did one in Chennai yesterday for a group of vets. We have another in Bangalore, and we did one in Coimbatore when we arrived. We also have some vet students in an hour, so we're going to go and teach a room of vet students. And the approach is slightly different depending on who we're speaking to, but for the vet students, actually the importance of the talk will just be to consider the nutrition of dogs. Because for me, the excitement with nutrition is that I didn't realize 5 or 6 years ago how often nutrition will fix or prevent a disease rather than waiting until the disease happens and then trying to fix it with a tablet or and I have some good cases where I've just seen incredible turnarounds with things that are so incredibly simple And I regretted not asking what they fed that dog early on. So I'm hoping to get these vet students to go into their practice. And when they ask their first set of questions, I'll say, how long has your dog been unwell? And what does it eat? I need them to say, what does it eat? So this is what we're going to do this afternoon.
It is so important, isn't it? People say you are what you eat.
Exactly.
So,
We seem to apply that to humans, and we often don't apply it to dogs in the same way, which is strange.
We hope all you dog lovers and animal lovers have tuned in, because this is a very special Indulge podcast for you. We have with us Dr. Charlotte Gray, and we're going to get into this interview. We're going to be talking about very interesting things about nutrition for dogs. So, Dr. Gray, let me get right to it. What is the right food for dogs?
So I have two aspects to this. I try in all my job, in all my work, in all my talks, to make clear that not everybody can do the same thing. And I don't think we should ever be making owners feel guilty about what they do. However, I think the fact that I've moved in to work with Right for Paws probably kind of highlights how I feel about what the right kinds of foods are. We're seeing quite a lot of growing evidence that less processed foods are better for dogs. So we had some very recent studies in Finland, and those are some of the biggest ones, where feeding dogs up to 20% of unprocessed food, so not 100% kibble, making sure they have 20% of fresh food when they are young, is providing some protective effect against allergic diseases when they grow up. So things like irritable bowel disease and food allergies, atopic dermatitis, which is skin allergies. There are lots of other little nugget studies that have come up, but these are the two most recent, very large ones. And it's starting to confirm what owners and some vets have been saying for decades, which is that whilst kibble was a good option then, when it was made, maybe we've missed something here. And this is what we've been talking to the older vets, the grown-up vets about, is perhaps we've missed something and we think we should be moving back towards fresh foods. We do have pros and cons to different kinds, and actually I think later on we'll probably get to talking about why actually I'm now working with a dehydrated product rather than let's say a raw product or something unprocessed.
So you're making a big statement here. So you are saying that we have kibble and then we have 20% of thing. But is that something that you build up slowly and increase it? Is
20% is unlikely to upset the stomach of any dog. So you could be fairly quick about that. You could say, okay, we'll just take 2 days to add a little bit more. That particular study, it does actually follow that the more fresh food you feed, the better the response, the better the protective effect. The issue with me saying loudly, everyone feed less processed foods, is that the unprocessed foods, the home cooking and the raw foods, have a risk of imbalance. And this is actually where a lot of my career in this field started, is seeing these dogs where they had chosen to move to unprocessed foods, but they had not considered balance. And I think that's where my careful approach comes from, is that encouraging people to switch straight from kibble to unprocessed with no further knowledge is dangerous. Because if we say do a full switch, some of those dogs will then develop rickets or skin disease or other deficiencies. So we have to be careful and say, yes, I feel that if done properly, I do think unprocessed diets and minimally processed diets will be the way to go. Our proof is still coming. Our evidence is coming, trickle a little bit at a time.
Yeah. So if you're going to give them unprocessed food, do you need to supplement them with vitamins or
often
minerals?
You do.
Yeah.
So it's a lot of my job at home, just day-to-day veterinary, is creating bespoke recipes. So you have a dog with, let's say, kidney disease, and you look at the profile of every food. And because humans eat normal foods, there are lots and lots of lists of how much calcium there is, how much zinc there is, how much iron there is in, let's say, beef. Yeah. And my job is to match these up in a big spreadsheet and to say this is likely to produce enough nutrients for that dog. To do that at home can be surprisingly difficult because we tend to inflict our own nutritional requirements onto our dogs. So we tend to say, well, my dog will be fine. I eat like this and I'm fine. It's close, but it's not good enough. They cannot, for example, produce their own vitamin D. So we produce it in the sun. They can't do that. They need 3 times as much calcium as we do. because they're programmed to eat carcass and bones and things. So they need higher levels of calcium, and it's quite common that people fail to do that. The issue with just supplementing all dogs, which is how certainly when I came here sort of 13, 15 years ago, it was the norm in the practice I was in then to just give calcium to all puppies. So give calcium, it's a puppy, give calcium. What's happened now is this blanket, give everybody supplements, has become dangerous, because a dog that is eating a home-cooked diet, yes, that dog does need some fish, some eggs for vitamin D and some calcium. But the dog that's eating a complete balanced food, whether that's kibble, dehydrated, whatever, they don't need that. And calcium and vitamin D in excess are both dangerous. So yes, frustratingly, you do need supplementation, but the kind of supplementation you need will very much depend what you're already feeding. And that's an attitude that I'm hoping these vet students this afternoon will learn is now it's changed. We don't have one type of feeding anymore. We have 3, 4, 5 types of feeding, and we must ask the owner what they feed before we hand supplements to them.
Yeah. So I've always had this one question about, giving dogs and, pups especially, a lot of, vitamins and minerals. I mean, you need to give them some. But, and like you said, we always run the risk of, giving them too much.
Yes.
Yeah. I've always had this one question because I compare domesticated dogs, pet dogs to street dogs and so on, which are so healthy and,
Yes.
with whatever little they eat. So when we give them minerals and vitamins, are we in a way teaching the body not to absorb these vitamins and minerals from its natural food? Can that happen?
It depends on the minerals. So
Okay.
there are, what you say is not entirely untrue. In my usual daily life, I have more issue in terms of interacting minerals. So where are we talking about the excess calcium? If you give a dog lots and lots of calcium supplement, it may not, particularly puppies cannot control how much calcium they absorb. Adult dogs can, so you're less likely to cause a problem. Puppies, they cannot change how much calcium they absorb, and that is why they're so prone to developing orthopedic, bone disease when they're young. But the bigger problem is that calcium stops your natural zinc from being absorbed. So yes, you're right sometimes. If you throw lots of supplements in, you can stop a dog from absorbing other good things from their food. Usually it's not the nutrient in question, although for some minerals that's true. But the biggest problem I see day to day is actually calcium blocking absorption of other minerals where it's given in excess.
So let's come back to our basic question. How much should we feed our dog?
So that again is something that goes wrong a lot, I think. So if you're feeding a complete product, the best way to know how much to feed is to read the bag. And I know that sounds so silly and so simple, but companies like us, so the back of a Right for Paws packet, I did some maths there. So I've done maths that looks into how old the dog is, how heavy the dog is, how active the dog is. And then we work out how many calories that dog needs. And then that tells us how much food we need. And we also then have to take into consideration how many calories they can absorb per gram. So because digestibility of the less processed foods is higher than, let's say, kibble. So often they need to eat less. So the packet for us already takes into account all our research and all our understanding and turns it to calories. The same is true for your other, your dry products, your canned products. So those are quite simple. Read the bag. If the dog is getting fat, feed slightly less. Usually 10% change, I would say. So go 10% down if they're overweight, go 10% up. If they're underweight, weigh them again, change. Easy. Home-cooked foods and raw foods, very difficult because a very, very lean, low in fat food will have a lot less calories and a lot less energy per gram. So if you feed, let's say, mostly rice, fish, low fat foods, chicken breast, let's say, without the skin, you feed things like that, you'll find the volume you need maybe twice as much as feeding a very high fat food. So if you fed lots of beef trim, if you fed some organ meats and things. So it's common, definitely in the UK, we see a lot of obesity on home cooked foods because people tend to feed more. A good rule of thumb might be, for owners, I think, if you're looking at a processed dried food, so be that kibble or dehydrated, remember the water. Remember that fresh food has water in it. If you are used to feeding a kibble food or a dried food and you need to switch to a fresh food, so whether that's home cooked or raw, it's likely to be 3 times the volume. Because you've got 60% water lost in the products that are dehydrated. So that's a common problem I see, and I think maybe that's a useful takeaway point, is that if you have a kibble amount, if you go to a home-cooked product that is very moist, very wet, maybe start by going 3 times what you would have fed in a kibble food.
Okay. Is there some kind of a ratio that you can give us in terms of, if your dog is, 10 kilos or something like that, you give them, maybe 20 grams or, is there something like...
A common guide is 2 to 3% of their body weight.
Okay.
For an adult dog. So if you've got an adult dog, let's say this food is middle of the road fat content.
Okay. Yeah.
So, and the dog is middle of the road active.
Yeah.
And it's not growing.
Which
this is
all
all averages.
Yeah.
You could say, okay, if you're weighing the food in a bowl, 2 to 3% of what your dog's body weight is per day is a good place to start if you cannot work out the calories. You do have to be very careful to weigh your dog in 2 weeks, or do a thing called body condition score, where you check their ribs and, so you can just assess their body shape with this body condition score. Make sure that you do that in 2 weeks, because 2 to 3% of body weight is quite inaccurate compared to calories, but it's a good place to start if that's a fresh food that you're talking about. That won't apply, of course, to dry products because the water's gone, but that's fine because the dry products will have a guide.
Dog food's breed specific, or is it, just about quantity?
Yes, that came up the other day. There are differences in nutrition requirements for age and for activity. And that's because if you are very inactive, you don't need very many calories, but you still need nutrients. So we have you need to have more nutrients per mouthful. Because if you eat very little, you might find that you're low on your other minerals. If you're very high activity, you need a food that has a lot of calories per mouthful, because you may not be capable of eating enough if you're eating it in very, low calorie form. Reminds me of a chap at university who used to be on the rowing team, and he used to eat a whole packet of chicken and a whole packet of rice for dinner, in a mixing bowl. There's only so much you can fit in your stomach. So when you have the high energy dogs, they need a high energy food. The notion of breed-specific diet, I'll be honest, I think there are a few cases where it's useful. So maybe Dalmatians, where they have a predisposition to certain types of urinary stones. Okay, I understand that. But I think a lot of the breed-specific diets made by other companies are marketing and not a lot else. There are a few things that they try, there are certain amino acids, for example, that are good for black coat. So Rottweilers, you have Rottweilers, so you'll understand that. But realistically, most diets should provide that anyway. So I feel that the notion of putting your dog on the front of the bag is mostly so that you can go, look, it's my dog, so that you buy it. Those products, they don't vary as much as they look like they do between products. I'm far happier just feeding a very high quality product and then making sure that I account for their energy needs and their age first.
And how many times should a dog be fed?
If you can, so a large breed dog and a small breed dog, I feel differently about. So very small dogs, toy breeds, you do ideally need to feed them a few times a day, because they genuinely they suffer from low glucose sometimes if they don't eat regularly, because they're tiny, their energy burn per gram of their body weight is very high. They lose a lot of heat. Granted, in India, that's probably less of an issue than it is in England, but they lose a lot of heat. So they do well twice a day. Medium-sized dogs, if you want to feed your dog once a day, which can be useful in a hot country because sometimes they won't eat when it's very hot, I don't have a problem with that. And several of my dogs do actually eat once a day because they choose to eat that way. I can't stop that. Very large dogs, so deep-chested dogs, your Great Danes, things like that, they have a risk of a twisted gut. And that happens because the weight of the gut is heavy. So if you feed a dog like a Great Dane who has a very high calorie intake need, all of that food in one go, they have a very heavy stomach for a short period of time. And the risk of that turning on itself is much higher. So if you have very large dogs or very deep-chested dogs, English setters, pointers, I don't know if you have all these breeds, Labradors even, you are better to split that into 2 meals, again, like the toy breeds, but for a different reason. So depends on the dog very much.
Oh, that is just some amazing information. I hope you're listening. Yeah, if you have a large dog, if you have a Great Dane at home, remember to feed them small quantities and more times. Are snacks and treats good for dogs?
They can be. So there's two ways to look at this. If your dog is overweight, you do need to look at the snacks first. So a lot in the UK, certainly, most of the dogs that are obese, it's not the food that they're eating, it's the snacks in between. It's the things, the bits of toast, it's the bits of rice, it's the leftovers from the plate. So there's that view where we say, okay, if we're only talking about calories, maybe we need to be more careful about snacks and treats. But that study that I was talking just now, that survey, they suggested that giving table scraps was part of their study, that was part of their information. It wasn't just dogs being fed deliberately fresh foods. It included dogs that were being fed table scraps. And that actually had a protective, beneficial effect for them.
Interesting.
So the other idea is to say, okay, well, if the dog is overeating in calories, maybe we should cut back a bit overall, but there's a possibility these snacks, so long as they are healthy snacks, so fruit, vegetables, meat, rather than, let's say, leftover sweets or, as long as it's healthy snacks, I would say there might be benefit to that. Especially in old dogs, actually. If you have a very elderly dog, making sure they have lots of fruit and vegetable snacks. The antioxidants help their cognitive function. That's a listed, it sounds like a made-up thing, but it's not. It's our big textbooks, our big veterinary textbooks tell us that if they have something called canine cognitive dysfunction, if your dog is old and is confused, that giving them lots and lots of fruit and vegetables will help their brain function. So in that vein, snacks, if you choose the right ones, might actually help. So
yeah, dogs are not just pets anymore, right? I mean, we are pet parents, and there are children, and we want to feed them everything that we eat.
Yes.
So what do we not give them? I've been told chocolates are bad.
Yes.
Yeah.
Okay. So there are some things that are just absolute no. Chocolate is one. So the darker the chocolate, the more dangerous. So if you don't feed any, in my opinion, but if a dog accidentally steals some milk chocolate or some white chocolate, chances are they'll be okay. Still call your vet, they'll tell you for sure, but usually they're fine. Dark chocolate's very dangerous. So dark chocolate has a chemical called theobromine. Theobromine is like caffeine, but they can't tolerate caffeine like we do. We love caffeine, but they can't. So you will find those dogs then have very, very high heart rates, very high blood pressure, and sometimes they will have kidney failure as a result. So that's what happens with chocolate. Some of the other things that people don't realize is raisins. Raisins, because it doesn't seem, lots of people will have raisins mixed into rice, into puddings, things, and give them to the dog. There is, unfortunately, variable response. So some dogs respond worse than others, but I have seen dogs with renal failure, with kidney failure, but from raisins. And in England, that tends to be around Christmas because we have mince pies. So it tends to be mince pies at Christmas that cause dogs to be in hospital over Christmas. So raisins, another thing. Onions. That's a difficult one here because everything has onions. Yeah. Uncooked onions may cause a type of anemia. But again, uncooked. Personally, I don't feed cooked either because I'm not brave. Yeah. So I would prefer that dogs didn't eat onions. Yeah. Full stop. But I appreciate here lots of your leftovers will have some. And I would also say from personal experience, many dogs eating small amounts of onion leftovers have no issue. But we just have to be sensible and say,
But what about garlic? Because I know that...
garlic is a difficult one. So again, as a vet, if someone asks me in my practice, can I feed my dog garlic? I will say no.
Okay.
Because it comes from the same family as onion.
Yes.
And if you eat enough of it, you can give yourself the same anemia.
Okay.
But the study that told us that involved eating a lot of garlic.
Okay.
So a bowl.
Okay, yeah.
So out of choice,
no. Okay.
But if your dog eats a small amount of garlic, chances are nothing's going to happen.
Okay.
Again, your vet will always be the port of call because they will have, we certainly have a little book of toxic levels.
Yeah.
And an owner calls and says they ate 20 grams of this and I go,
Yeah.
Oh no, that's fine. Go home. So,
Yeah, because in India, garlic and turmeric, supposedly have, they do have
Yes.
medicinal properties.
Exactly,
So,
yeah.
when you cook meat, you tend to, add a little turmeric or,
Yes. Turmeric is
garlic.
definitely fine.
Okay.
Yeah,
Okay.
turmeric is definitely fine. And garlic, I work with lots of herbal vets in the UK. So I'm personally not one. I'm a conventional vet who works in nutrition. But the nutrition overlaps with herbal approaches so much that I work with a lot of herbal vets, and they do prescribe and use garlic, which is why I have this kind of difficult to use on the fence approach to garlic, because I get that it does have medicinal
But turmeric
effect.
is good.
Turmeric's fine.
All of us have had this problem at some point of time or the other. So, where you have a pup or a dog and it's not eating. So how do you make a dog hungry?
So the first thing is the temperature of the day. So if you have a
Okay.
dog who is really not eating, it's worth trying to feed them when it's cool. So either in the evening or first thing in the morning, because some dogs just don't eat when it's hot. So that's a good place to start. Is just change your feeding time. It might be that they need that. If you have a medium-sized dog, sometimes they will, or certainly at home, I find they dodge breakfast and then actually just pick it up 20 minutes later. Just say, okay, they're not hungry. Try again in the evening, because those are two simple things. The other thing, though, is, of course, if they just don't like the flavour, and then you have two options. One option is you change food. And many people will have tried this 20 times already. They've bought the whole pet shop. Sometimes you can try just changing the food to something they like. Fair enough. The other things that work, though, are things like adding water. If you've got a dry food, whether that's a dehydrated food like ours or a kibble food, adding warm water and letting it soak. Some dogs like the smell. So because they rely a lot on their sense of smell, and particularly dry foods, the smell is not the same. They know that it's not meat, and sometimes just moistening the surface where they've put those flavourings and things, sometimes it helps them to like it more. We do that a lot in the clinic, actually. If we have dogs on, anti-nausea medications, we'll heat their food for them because they prefer it that way. But yes.
We touched upon this, but if you could, just throw some more light on, processed food versus, cooked food, and when to feed what. Personally, for me, it's very easy for me to give them a little bit of kibble in the morning. Yes. Because I'm rushing off to work, and I can just feed that. But when I come back home, I could probably, make some food for them. So how does one balance this? You said 20%, but then, is there?
Yeah. So if you're going to feed a large proportion of the diet in something that is fresh food, let's say, you need to be mindful of the balance. And something we've been speaking to the vets about is saying, look, we think that there are benefits. We're seeing that there are benefits to feeding fresh foods because they have less reaction products that are formed in the processing. They have better vitamin availability, better digestibility. We're saying we know these things, but none of those are any good to you if the balance is wrong. So we've said to them, if you're feeding small amounts of this fresh food, so if you're feeding 10, 20%, fine. The balance is no big deal. Try to include some meats and vegetables. You're not going to ruin the dog. If you need to feed more, buy something that is as minimally processed as you can, but balanced. So you want to add something like a dehydrated food, like the Right for Paws one, or if you can find a good, in the UK we have some good brands of home cooked style product, or raw but balanced to international guidelines, things like that. We have good balanced products, and that works for me. So I have dogs. We have 5 dogs at home at the minute, and some of my dogs eat kibble for some of their meal because they can't eat enough calories if I don't. And I can't get Right for Paws in the UK. so I can't use it yet. So I have those dogs will eat a high fat kibble, and I mix then a complete raw product from a trustworthy company that I use in the UK. I mix that to make their food more exciting and to get their fresh food in.
Raw food versus cooked food. How does that?
Pros and cons. So raw food will obviously, by the nature, is completely unprocessed. So it has no mineral losses, no vitamin losses, and it has any kind of cofactor that used to be there. Anything that helps absorption is still there. So it has its pros. The problem is issues with pathogens. So we have things like Campylobacter, Listeria, Clostridia.
Yeah.
Dogs appear to be fairly resilient. So, we have the same group in Finland, actually, the dog risk group. They have some studies looking at this, and dogs do appear to be very resilient to them.
Okay.
But some of those bacteria are pathogenic to us.
Yeah.
So it boils down to our handling and our storage, and certainly in a hot country, the transport of products like this. Because moving products like that across a country, you are at risk that it's going to get warm if they, you can't stick it in the post like you do in the UK where it's cold.
Yeah.
So pathogen risk. Something that I started out working a lot on as well was nutritional balance. And that's an issue whether it's home cooked or raw. So home cooked diets tend to be more difficult to get right from a nutrition balance point of view, because dogs are, like we said, they need the 3 times higher calcium.
Yeah.
And sources of calcium in humans, we tend to say, it's okay, I've eaten milk, yogurt, cheese, I'm fine. It's not enough for a dog. So the nutrient balance tends to be worse in home cooked diets. But as the industry of raw pet food gets bigger and bigger, some of the complete products are cutting corners and spending less money on their product. And now they are really poorly balanced as well. So I think any food, any kind, the balance is important. Raw, we have this concern about pathogens, and then home cooked, we just have to be very careful about.
Yeah. Yeah. See, unfortunately, what happens is we only know a food is not working for a dog when we see our dog reacting to it.
Exactly.
So what are the signs we look out for?
Yeah. Again, I'm going to make sure the students do this later.
Yeah.
So the things that everybody recognizes is bone disorders. Everyone's wise to that. Everybody looks for their feet splaying or their elbows bending or their front legs bending. Everybody sees that. What people don't consider nutrition in is things like skin. So something very common, home cooked diets. Dogs tend to have a lack of zinc. They quite often have, a lack of fat, lack of fatty acids. And one of my very original cases, right from the start, had vitamin A and vitamin E deficiencies because she had not enough fat to allow her to absorb them. And she had dry, scurfy, itchy hair. And we did all kinds of tests because at this point I didn't ask then, because it was a while ago, and I didn't ask what this dog ate. And actually this was a low fat diet she was eating. A lack of fat will cause skin issues, partly because they need the fat for their skin oils, but also because it needs oil for absorbing A and E. So make sure if you have a dog with skin disease, yes, it might be mange, yes, it might be hormones, yes, it might be heat, but it might also be that your diet is too low in fat. So that's one. Yeah. With the raw food diets, we have different set of problems. Quite often I see problems with zinc because the level of calcium in cheap raw foods will bind up that zinc in the gut, like we said with talking about nutrients earlier. And the lack of zinc can cause upset gut trouble. So again, you have your dog, it has diarrhea sometimes. So it has on-off, usually it's on-off diarrhea, sometimes on-off gut pain. Some of the short-faced breeds, the French Bulldogs, they will have reflux, they have acid stomach and gastritis. And some of those dogs, what they're suffering from is zinc deficiencies and from sometimes an excess of fat doesn't help.
Okay.
But that's something in the UK I started talking about at a veterinary herbal conference in 2020, just before COVID. And those vets, since then, it's a group of about 15, 20 vets, they have been zinc supplementing these dogs, and it works so well. Okay. So we know we're right. We need a study, but we know we're right. So gut trouble, skin trouble, it's not always a medical issue. Sometimes it's just the food. Yeah.
Another problem we have is, India is now moving towards raw food. We've suddenly become aware of, raw food for dogs. How does one make the transition? Because you've been giving your dogs cooked food for some time now, and then you want to start giving raw food. So how does that?
There are several fashions in how to move. A lot of, I would say, there are a lot of social media pages for raw feeding, and each will advocate changing in a different way. I've read people say, do it with just tripe first, do it with just chicken first, do it with just, To me, this is all silly. Which thing you add when doesn't matter. The important thing is that you're gradual. Because a dog's inside system, these kinds of food differences, they affect your gut bacteria. They affect your enzymes. It takes time. Our bodies are very clever. The dog body can change quite quickly, but they need time to change their enzymes and for their gut flora to change. Okay. So for me, I actually use mixed product. I tend to make up a batch of mixed up product. I don't tend to feed individual pieces because I have lots of dogs and they fight. So I will actually go 10% the first day, and then I'll check that their poo is okay, that they're not being sick. So on. Next day, 20% of the food will withdraw. Next day, 30%. Next day, 40%, and so on. So 7 to 10 days gives them a chance to get used to it.
When you buy, let's say, I'm moving to raw food with chicken. So, I would keep my chicken, I would store them frozen, right?
Yes.
And, so when I take it out of the freezer, do I have to thaw it, or do I just...
Ideally, because the bones are brittle when they're frozen. This is the main reason. There's nothing strictly hazardous to me about the dog eating the meat frozen. But the issue is the bone is brittle. So I would treat that like I would my human food. I would put it in the fridge, I would defrost it, and then I would feed it defrosted. And assuming that we have the balance right.
Yeah,
I would defrost it.
Yeah, interesting. What about vegetarian food?
So we should make the distinction between vegetarian and vegan, because vegetarian food is fine.
Because you have egg.
So eggs, dairy are good sources of protein and good sources of vitamin and minerals for dogs. So egg-based diets are fine. And I have lots of, dogs with liver disease, dogs with either liver shunts or liver cancers and things, those dogs do better on vegetarian diets. So I have lots and lots of clients who eat, where I formulated for them diets that are based around eggs and cheese. And that is hugely beneficial to them. Eggs, cheese, rice, eggs, cheese, pasta, eggs, cheese, buckwheat, whatever, because that works for them. And it's a very good source of protein. Vegan diets are more of a challenge. We've had some studies, I think but I think it was before COVID happened. We had perhaps 2016 to 18, an issue with grain-free foods. And what was happening is that the dogs that were eating these grain-free foods were developing a heart condition called dilated cardiomyopathy. So the heart stretches, and then because it's so stretched, it can't contract properly. That wasn't a vegan food, but over the years, the universities have investigated this, and the issue they found is vegan protein sources. It's lentils and peas currently. And they are still investigating it, but they're speculating that the nutrition in the food looked normal. But when it went into the dog, it caused taurine deficiency, which is an amino acid deficiency in lots of cases. So something is happening between when it goes into the dog and when the dog absorbs it because of these protein sources, this lentil and pea protein source. So for me, my concern is that we don't understand what happened there. We don't understand why lentils and peas are affecting digestion of other nutrients in that food. And vegan foods at the moment, I think there is a risk we're going to cause diseases that we don't yet understand. So I actually won't formulate commercial vegan products. People have asked me to do it. I'm not happy to do it. I have formulated bespoke vegan diets for owners who are vegans themselves and who do not and will not handle meat. Because for me, if I can produce them a diet that is as close as possible to what I would consider ideal, that's far better than me saying no, because then they'll go make it up themselves. So I think I would love for it to become possible, because the ecological potential is huge. So I would love for it to become mainstream. But right now, I find it a tad uncomfortable. And I think reducing your environmental impact by feeding it sometimes, if that's how you feel, would be safer than feeding it all the time.
But would it be possible to, give them like a vegan diet and supplement them with something?
You can. The issue is we don't know. So this is exactly what I do with bespoke diets. So bespoke diets, if I'm making a vegan diet, I say, what do we already know is likely to go wrong? We know the taurine is likely to go wrong. We know the B vitamins are going wrong. So I will supplement those quite heavily and say, look, we know this is going wrong. The trouble is, for some nutrition, if you over supplement, you'll cause a new problem. So if I give too much and I'm wrong, I might cause a problem. With one dog, this is all right, because I can say to the owner, look, these are the things you need to look for. Tell me if it happens, we'll change. But with a large scale recommendation, it's very difficult to say, yes, feed a vegan diet, just give this supplement, because I'm worried that people won't see the problem early enough.
Yeah. So vegan diets mostly are always cooked, and but coming back to a raw food diet, as you said, there might be problems when you're transporting meat and
Yes.
and so on. Is there some way that we can clean them or wash them? Because
Yeah.
is there?
Yeah, we can use, so there's different ways of doing it. Obviously, we can do processes like we do, where we have a dehydration process and a UV treatment process and bacteriophages. So we can use different approaches to clean meat in a commercial factory environment.
Yeah.
For owners at home, it's
Yeah.
more difficult because
Yes.
you cannot cook a food that contains bone, because the bone, like we say, it gets brittle. They don't absorb it.
Yeah.
So you can't heat it in the way that we do, because our approach is very different to home cooking. So it is, the short answer is it's very difficult to do it in a home setting. For things like beef, potentially, I guess you could flash fry that outside or steam. But I think realistically, we have to say raw feeding will always come with a small risk of pathogens. And that, I say that as somebody who does raw feed, so it's as well. So I know it's not that I want to stop people.
Yeah.
I just think people have to be very aware that will always be a problem unless you are buying a product where they have tested for pathogens, which many raw pet foods in the UK do, or where they have eliminated pathogens on a commercial scale before you buy it.
So dog lovers, we have a very special person with us today, and we are coming to some very interesting parts of this interview. Moving away slightly from your area of expertise, and we're talking to you more as an animal person, as a dog lover. Dogs have food aggression.
Yes.
How do we deal with that?
Yeah, so it depends on your environment. So I've always had a lot of dogs, and I had 10 for a while, and then now I'm just down to 5 for the minute. I think a lot comes, many approaches try to stop dogs from behaving like dogs.
Okay.
And I think we have to be realistic. It's natural for a dog to say, no, this is mine. You can't have this, you know? And I really dislike the kind of television approach of, keep walking to your dog's bowl and annoying them just to force them to give in to you. I hate that. I think it's dangerous and I think it's silly.
Yeah.
I think a dog is a dog. Yeah. Let's be sensible. Don't wind them up. Don't put them in the position where they need to be defending their food. This is how I feel about it. So my dogs are fed. So when I had 10, and even now when I have 5, when I'm feeding my dogs, I put them in different places. Okay. So that they don't. So I have dogs. Some of my dogs will go in a kennel. Some of my dogs will eat in the kitchen. So that they're not in a position where they feel threatened. I do have some dogs that I know get on well and whose hierarchy is clear. And those dogs, I'm happy for them to eat in the same room because I trust them. I've been like that. The other issue, of course, is possession aggression with humans.
Yes.
There's 2 parts to that. I don't disagree with the notion of walking past the bowl and dropping food in it. That's okay. I don't like the thing where people take the bowl away. There's an approach of dominating the dog where you take the bowl away, prove your dominance. That, I think, is a recipe for getting bitten. Yeah. But what I do think, if you have a dog who is human aggressive when they're eating, I don't think it is a bad thing to walk past their bowl, drop a little bit in, ignore them, don't interact with them, just walk past, give them a little bit, walk away, walk past, put a bit in, walk away. But the other side to this is if you have children, just keep them away from the situation. Because we have dogs in the practice all the time being presented for euthanasia for biting children for food aggression. And for me, this situation just shouldn't have arisen. It's all very well putting the dog to sleep, but the child has scars on their face. Just don't have children near dogs who are eating ever. I have a 5-year-old. She's allowed to put the food down for them, and then that's it. She has to walk away. She's not allowed to stand there or pat them, while they're eating.
So we've spoken a lot about dogs. So cats?
Cats, yes. I have a lot of cats too. So nutrition in cats.
Yes.
Yeah. So a lot of the same applies. So a lot of the same applies. And I spoke yesterday with the vets in Chennai about a case from maybe 10 years ago where I had a big fat tabby cat, huge. It wasn't mine, this is a client's cat. And it had IBD, which is allergic gut disease. And we had a long battle with this cat. So it had referral hospital treatment, it had immunosuppressive medications, it had different diets. We went to hydrolyzed food. So this is the special vet diets that have broken up proteins. And we couldn't manage this cat. And actually, in the end, this big fat tabby cat became a skinny, sick cat. And really sadly, we did then put this cat to sleep. And I don't tell you that just to give you a sad story. I tell you that because many years later, I was then working in a cat sanctuary, and I still do. I work cat sanctuary 1 day a week in the morning. And we see huge numbers of cats in those environments with this allergic gut disease, because many of them had a very bad start, very bad start. And because these pets are not owned, because they're owned by a sanctuary, I have a lot more freedom. Because, they're not, nobody tells me off. If I get it wrong, I can try again. And it doesn't cost any different. I'm there. So we started trying different foods with these cats because we had the option to, and because I'd moved into whole food feeding. And we had this group of feral cats. So it's Marmaduke, Dave and Dave. So Marmaduke, Dave and Dave. And we moved these cats after doing the same things, the same procedures, the same testing, the same trials. They were still skinny. They were still leaking diarrhea, not just going to the toilet, but leaking down their back legs. And we said, okay, they're going to die if we don't. Let's put them onto an unprocessed food. And that's what we did. And those cats are now fine. And that was the first one that we did like that. Those 2 cats now. So the sanctuary joked with me. They said, but what you've now done is created expensive to feed feral cats. What do we do with these now? Nobody wants these cats. So now these cats live at my house. So Marmaduke and Dave, they live on the farm. They hunt rats, and they do okay on an unprocessed diet and rats. That's all they eat, and they're fine. But since then, because we saw that happen once, we've done it since. So we have the same. We don't disregard the normal treatments. We're not saying all the normal treatments don't work, but definitely in that environment, we have cats. We had Bilo, a cat called Bilo, who we treated for years, and he sadly died recently of kidney failure. He didn't die of his IBD. We saved his life with food. So, the same applies. I think we have to be very sensible and say, look, there are situations this new, well, it's not new really, is it? It's old, but feeding less processed food has saved a few cats as well as a few dogs in my career.
This has been so enlightening and so interesting, Dr. Gray. One last question. How does one become a veterinary nutritionist?
It's a long road. So you will need to go obviously to university and become a vet first. So you have to go do your 5-6 years. I think depending on the country you're in America, it's 2 separate courses. In the UK, it's just 1. So I did 6 years because I had an intercalation in zoology, just a year and doing a different degree. When you come out of university, the trouble with the nutritionist term in the UK and the USA is that we don't have, so I should explain actually how we have our normal veterinarians. Then we have certificate holders who are people who can evidence extra knowledge and they took an exam in a topic. So heart disease, cardiology, orthopedics. And then we have our board certified and our diploma holders. And those are the top dogs, the top guys, the guys who know everything about everything in that topic. And they have to be participating in research as well to be at this end. The trouble in the UK, we have normal GPs and we have board certified nutritionists. There is no certificate available because there is no one to train it. So in the UK, what actually happens is you graduate from university, you work really hard, you develop a reputation, and you speak to your colleagues and you say, look, I like this, I'm good at this, send me the cases you can't handle. And that is what's happened. So over 5 years, I've become quite well known in England for being quite good at it, I think, but also for being very open to these other feeding methods because some of the other nutritionists aren't. So I think that's where I sit at the level of a certificate holder, but there is unfortunately no way for me to stick a label on it in this country. So I have asked about doing the same thing in America or Europe, but that's where that is. But you will also have your board certified. So we have our board certified nutritionists who are the best of the best in the UK. And I would sadly say I'm not one of those, but there are only 2. So there are 2 of those guys. And to get to that, you actually have to do something called a residency. So after your degree and after your practice, you then go away to train somewhere else for 4 years. The trouble for me is I have children, I have a farm, I have dogs. I can't move to Scotland for 4 years to do that. So I've gone a different route, but you can go a different route. I think as long as you have the degree, I think many vets believe, because of this lack of certificate, they believe nutrition is too hard. It's not. It's not too hard. You just have to, you have to really want to do it, and you have to engage with your patients about it, and you can do it.
You also work with some colleges.
I do,
So is there some pedagogy that you're putting in place for, for students?
For teaching them. So I've got some talks that I do for universities. So I've had some work, some small seminars with Royal Veterinary College in London and with the Ross University, who I think now are based in Hawaii. Very nice. Those talks tend to be like what we're doing this afternoon in Chennai. So mostly what I want to do when I go to these short talks is motivate them to turn up to the other ones for their university, because nutrition feels unimportant to many students. And honestly, it felt unimportant to me when 15 years ago, I didn't see the point either. I figured you just give them dog food, they'll be fine. So mostly these short talks, my aim is to get them enthusiastic. I don't care which type of food they want to feed. I don't care where they end up. I just want them to ask about food, be excited, and remember that it's a contributor to disease. So that's most of the short ones. The long courses, so I've got a course running what they call CPD, our Continuing Professional Development in the UK. So I run the courses then for adult grown-up vets, who've already qualified, to help them to use nutrition in general practice. And that's a 4-day course. So they come, they learn how to use formulation software. They learn to understand things like nutrient bioavailability. How is one supplement different to another supplement? How is one food different to another food? How do you decide whether that dog in front of you has a nutritional deficiency without blood testing it? Because many people can't afford to blood test it would cost you £1,000 to blood test everything. So how do you know which one to test, and how do you then go forward and treat that? And that's the 4-day course that I run, which is with a company called Longview CPD. And students can join that, but not until they have to qualify first before they can do that, because I need their basic understanding in place first.
Thank you so much, Dr. Gray. Thank you so much for making the time. It's been a very enlightening and interesting conversation. And listeners, I hope you've learned something about feeding your dogs and cats. Thank you so much for tuning in. See you all till the next episode. Thank you.